Hi, my name is Audadoskol, and today I will be briefly speaking about communication and ethical issues related to healthcare. First off, principles of scientific communication enhance understanding, trust, effective decision making in any type of healthcare setting. For instance, according to an article by Don V.D., the key principles of scientific communication are clarity, precision, evidence based information, consistency, and transparency. For clarity and precision, for example, that should be clearly articulated, free of vagueness to ensure understanding. If a physician is going to explain a complex surgery, it's important to use layman's terms with the patients and ensure that the patient has full understandings of risks and benefits. Evidence-based information as well must be provided by reliable data. For example, a medical research paper reporting on efficacy on a new medication and drug includes statistical analysis citing clinical data and as well as its conclusions. Transparency is just as important as well, and it goes along with the second one, which is ethical implications in human research for health professionals revolve around maintaining patients' rights and welfares in any type of study. This includes informed consents, benefits, confidentiality, and equity. And lastly, IRB reviews, which is the institutional review board that upholds ethical standards. These principles ensure that patients have a patient trust and a safeguard to the integrity of the research and outcomes for safety of patients as well as healthcare professionals. Next would be ethical issues in communication when conducting research in the allied healthcare field revolving around transparency, confidentiality, and accuracy. For instance, in some dental offices, a dentist can diagnose malocclusion so he can refer the patient to an orthodontist. However, within recent years, the dentist himself or herself can also fix the malocclusion for the patient using clear aligners and not need to be referred out to an orthodontist. Ethical issues around communication can arise when obtaining informed consent from patients. In this case, the healthcare professional, the dentist, must ensure that the patient fully understands the risks and benefits and other alternatives. So the dentist can say, you can go to an orthodontist to get this fixed, or you can stay in office with us. Me as a dentist have, these types of degrees to do special movements with orthodontia. Miscommunications or incomplete disclosures could lead to patients agreeing without proper knowledge, violating ethical issues and standards of autonomy and transparency. These principles ensure ethical compliance and protect all stakeholders in any type of healthcare area. Next is an example of how you would communicate efficiently and appropriately with patients or family members. Effective communication within the scope of practice involves the following strategies. For example, with patients, you must use plain language, layman's terms, active listening, and empathy to ensure understanding and to be able to build that trust. Tailor the communication to patients' literacy and cultural background as well. That is also very important. For example, another way to demonstrate effective communications is in a writing formal correspondence as well. You must be able to use a professional tone, maintain respect, clarity, and formality throughout a letter or throughout an email. An example of this would be like a letter to a parent. It would need to, in regards to the child's health, it would need to clearly explain the treatment options, as well as the next steps, address any questions or concerns, and use a compassionate and straightforward tone. It would read something similar to, "Hello, parents of Sally. It looks like Sally is due for her next dental checkup. What to do next? Please go online and book your appointment, or you can call this phone number 1-800 to schedule your appointment. At this visit, we would check for dental hygiene, decays, and any questions or concerns you might have." and then the office information. Please feel free to give us a call. So all of these information is very important, and references will be below on the description of the video. And it is important to talk about ethical communications and issues related in healthcare in all various types of ways. Thank you.